Okay, we are at 1:15 straight up. I am Chuck Carney, Director of Media Relations for Indiana University, and welcome again to our weekly briefing on all things regarding the COVID-19 pandemic in the city of Bloomington, Monroe County, Indiana University, and Indiana University Health. We usually begin with Mayor John Hamilton for opening remarks. The mayor is out today. There is a staff retreat, and that has involved a lot of the people in leadership at the city, but he has asked me to read an opening statement on his behalf, and I will do that. I will not attempt to sound like John Hamilton. I'll just read it, just to let you know. So the mayor, first of all, extends his apologies for not being able to be here and says this: there have been 6 new COVID cases in the last week among the city workforce, the highest weekly number in 2021. 1 at the Emergency Dispatch Center, 1 in Public Works, and 4 at the City of Bloomington Utilities. These cases were not related to previous cases at the city or to each other, and no members of the public were exposed to COVID-19 through these employees in the course of their work. There have been a total of 104 positive COVID results among the city workforce since March 2020. We continue to incentivize city workers to be vaccinated to protect their health and that of our community by offering a $100 wellness benefit upon submission of proof of vaccination. Thus far, our Human Resources Department has received 590 proofs of vaccination, which represents approximately 63% of regular full-time and part-time employees. City of Bloomington Utilities continues sampling wastewater at the 2 wastewater plants for COVID-19. The Blue Pool samples for September 13th showed 220 gene copies per 100 milliliters, and the Dillman Treatment Center showed 420 gene copies per 100 milliliters. And each of those represents an increase from last week. And that is the statement on behalf of the mayor. We will begin with other statements. First, going to Monroe County Department of Health and Penny Caudill.
Good afternoon. I'm going to start with testing today because I received new information about an hour ago, and I want to be sure to share that with everybody. We talked about last week that the Indiana Department of Health had announced partnership with Gravity Diagnostics to provide COVID testing at various sites throughout Indiana. That did mean a change for us in the plans that we had been making to open up our Morton Street site. So we know with COVID-19, change is constant, even more than it is in normal life, it seems. We will be having a testing site in the county, community site, but it will be through this partnership with the Indiana Department of Health and Gravity Diagnostics. It is planned to open on Tuesday, September 21st. They will run initially Tuesday through Saturday from 8 to 4. It will be a drive-through to begin with, and they will be offering PCR testing with results back by 5 p.m. the following day. And the location will be at 500 North Profile Parkway. So that is where we had the previous drive-through at the beginning of the month, I think it was. It's Cook property, and we thank them for working with diagnostics, Gravity, to make this happen. As I said, we want to get them open and started, and that's why the drive-through is starting, and then they will be working to secure a more permanent site for the duration of their time here that will be an indoor facility. So right now, PCR testing results back the next day, and rapid testing is expected to come, but it will not come next week. So that is to come later. And there was some confusion. Again, vaccine will not be initially available as well. That may come down the road too, but just trying to get these sites up and going. PCR testing starting next Tuesday, 8 to 4 p.m., Tuesday through Saturday. But I also want to remind people to check the coronavirus.in.gov. check that map for sites, testing sites that are available, because it does include mobile sites that kind of pop up. We refer to them as pop-up sites. They have more planning than maybe a pop-up site might, but where these mobile clinics go out. And an example is this week, NDOT offices across the state had these mobile clinics. So there was testing available at the NDOT office 2 days this week. So you need to check that map if you are in need of a test, because there may be something that's available to you that isn't a routine option. So please pay attention to that map. The other thing that the state announced is that they will have testing and vaccine available at Indy Motor Speedway from September 21st through October 30th. They sent a press release out about that yesterday. Again, that is on that map that I just mentioned. So if that's an option or an interest that you have, that is another way that you can do that. In terms of our advisory, and this is sort of the bad news, we had been holding steady at the yellow advisory. That changed this week. We went to orange. 200 cases per 100,000 and a percent positivity of 5.14%. Now, we almost stayed in yellow. 199 per 100,000 would have kept us in yellow. And so that was heartbreaking. But the reality is, either way, we have a high level of transmission. And that's really the takeaway. I wish that I could tell you that I expect things to improve next week. But when I look at the numbers, and we had almost 70 cases documented today, I don't anticipate that our numbers are going to be less next week. So what does that tell us? It reminds us of the importance of vaccination. It reminds us of the need for proper isolation and quarantine. And keep in mind that that's a little different whether you're vaccinated or unvaccinated. So follow the guidance that you're given by your provider or the contact tracers, or check the CDC website. If it's through your school, check with them so that you are doing what you're supposed to be doing. But if you are told to quarantine, that doesn't mean that you're going shopping at the mall and you're just not going to school or work. It means that you're staying home and away from other people, right? So it's same is true with isolation. If you are sick, you are not supposed to be at work. You're not supposed to be out running errands. You should be staying home so that you're not running the risk of spreading the infection to someone else. A close contact is somebody who may have been exposed to the virus and could become positive at any time. So that's why you need to quarantine. The other things haven't changed either. There's still a need for masks. We know that they work. They help lower the transmission. So wear your mask when you're in public, when you're with others, especially if you don't know their vaccination status. Continue hand hygiene and distancing or any of those things, even though they may not be in regulations. We don't have a distancing regulation right now. That doesn't mean that you shouldn't be using distance as a prevention measure and a strategy. So use those recommendations and follow the regulations as well. In terms of infections and vaccinations, the younger age group, those 10 to 20 years old, continue to make up the highest percentage of COVID cases right now. Breakthrough cases do occur. It is still 0.9% for Indiana fully vaccinated individuals. And in Monroe County, it's much smaller than that. So yes, we have people who have gotten vaccinated and have a breakthrough case, but the numbers, the percentage of individuals who are vaccinated and have a breakthrough case is very small. And then among those, your risk of hospitalization or death is even smaller. So get vaccinated. In recent weeks, less than 5% of hospital admissions were vaccinated. As of yesterday, we have 59.3% of our eligible population was fully vaccinated. So we're at almost 60%. We still have that one zip code that's over 70. I really would like to see every zip code in our county be over 70% vaccinated. In terms of third dose vaccinations, those are available for people who meet those specific immune compromising conditions. Talk to your healthcare provider. That additional dose may be available to you if you fit that criteria. In terms of booster doses, and when we talk about booster doses, we are talking about people who've been fully vaccinated and the concern that the vaccine effectiveness is waning, and we want to give another dose of vaccine to boost that immunity back up. That is being considered. It is not yet approved. The discussions and the decisions around that are being made now. So there's a process for that. We have plans in place to be able to act quickly once we have that information. But the two things that have to happen, it's got to meet all the approvals, and then we have to have directions. So what's the dosage, who's eligible, what's the process? So just know that you could hear something today that says somebody said it's approved. It's got to finish the process. So I know some people are very anxious for those. I just want to tell you that we're working on it, but they're not available yet. And the last thing that I will say is about vaccine clinics. Our nurses will be at Fiesta de Antonio, and I hope that I came close to pronouncing that right. I did not take Spanish, and I wish I had. But they will be there Saturday from 12 to 3 with vaccinations. And we would encourage people, they'll have Moderna at that clinic. So we encourage people, if you need vaccine, to consider that then. We continue to do other outreaches. We're going to the schools offering that. And we will be at the 50 Plus Expo that's coming up, I think, next weekend. So we still are planning those various outreaches. We'll also be expanding clinic vaccine days at Miller Drive at the Public Health Clinic. So those, again, if you go to ourshot.in.gov, all that information, the days, the times, all of it is there. And we will be ready to vaccinate you, whether it is your first dose or a second dose, or maybe even a third dose down the road. Thanks, Chuck.
All right, thanks, Penny. Let's check in with the Monroe County Board of Commissioners and Julie Thomas.
All right, thank you so much, Chuck. Thanks everyone for being here today. As always, it's always good to see everybody. And we appreciate the community's interest in getting updates from all of us, various parts of the community. So I just want to start by saying thank you to our health department and Board of Health for continuing to focus on getting testing and focusing on getting vaccines, especially those who've never had them yet. Sorry, that's Ollie the dog. He agrees, get your vaccine. So with that, I will note that we still have the Township Assistance Fund available, and that fund is available for anyone in the county who is struggling to pay for things like utilities or rent because of COVID, job loss, or hours reductions. Just go to your township trustee and ask about it. They have other resources as well, but this is a resource we provided with the Board of Commissioners provided with the County Council to ensure that people can stay in their homes. So every county resident lives in a township, whether you live in a city, town, or neither. So please contact your trustee. You can find the list of trustees in their minutes packet each week for the county commissioners. Also a note that there are 2 blood drives scheduled for October. We've been really happy to see the community coming together and really supporting the blood drives and addressing this significant need in our community because of COVID. October 21st from 2 to 7 and October 22nd from 10 to 3. And these are going to be at the Southeast YMCA. For more information, go to redcross.org. Thanks to this community, you've made Monroe County a stellar blood drive community, not only in the state, but across the country. So we're really proud of all of you for your contributions. And last but not least, I just want to note that I read this Washington Post article this week that talked about hitting the grim milestone of 1 in 500 Americans dying from COVID. That's a pretty horrible number. And when you go into the article a bit, you can see that in Indiana, it's 1 in 450. We can do so much better than this. So please, we do want to thank everyone who gets a vaccine and masks up and is following the protocols. But please, if you haven't been vaccinated yet, or you know someone who hasn't, please consider it. Go to your physician, go to your healthcare provider, get more information, and please get vaccinated. That's our way out of this. That is really how we're going to emerge. Thanks, and we'll take questions later.
Okay, let's next go check in with IU Health and Shawna Girgis.
Hello, good afternoon. Thank you to everyone for joining us again this afternoon. I just want to thank all of our healthcare workers and healers that have been fighting on the front lines for almost 2 years, and our partners that join us each week on this call to ensure a unified approach to healing our community. As you can see in the graph that's coming up on your screen, our region continues to see a high volume of COVID inpatients. The numbers between IU Health Bloomington and Monroe Hospital show this same pattern. And as you can see, of the COVID-19 inpatients we currently have in the region, the majority continue to be unvaccinated individuals. And our numbers of vaccinated COVID-19 patients in critical care or on a ventilator remain very low. Critical care beds remain a point of great concern across the country and here in Indiana. According to the Department of Health and Human Services, only 18.6% of critical care beds in the US are currently available. The national data continues to mirror what we are seeing here in the South Central region and our home state, with only 16.8% of critical care beds available here in Indiana. Our emergency departments continue to see an increase in volume of patients seeking care, and we continue to provide expanded access to those who are not in need of emergency care. We would ask that you please share this graphic, which you can find on our IU Health Bloomington Hospital Facebook page. By sharing this with your friends and family, you will help them know where to seek care for different healthcare issues that they may experience. Several weeks ago, our incident command across the IU Health system once again began meeting 7 days a week. We did this because of the latest surge, and this ensures that we continually have the resources, patient access, and other important information that are needed to continually be prepared to respond to the needs of our community. It's both inspiring and disheartening to see all the efforts caregivers and our support teams are going through. It's inspiring because they show so much compassion, purpose, and dedication to working together as a team in order to help others. It's disheartening because I know how tired they are, and I saw how hopeful everyone was when the numbers were low in the springtime. We were talking about an end to the pandemic, and then COVID numbers rose again while vaccination rates didn't rise as quickly as we all had hoped. All I can do today is ask you, the public, to please do your part in fighting COVID-19. Please get your vaccine, wear your mask, and wash your hands regularly. I'm happy to take questions at the end.
Okay, thanks very much. Next go to Indiana University and Kirk White.
Hey, good afternoon, everybody. Well, this week we were able to release our latest numbers of COVID, both on vaccination rates and cases. We continue to have additional vaccinations occurring with our students, faculty, and staff. Overall, our student numbers went up just a little bit, and our faculty staff numbers did as well. So we're now at 92.5%, and that's a bit of an improvement. We're looking good there. And then on cases, a little concern there because we've ticked up a little bit. Last week, you might remember that we had 63 reported cases on the Bloomington campus. That went up to 79 this past week, 63 of those being students and 16 being faculty and staff. But it's still down from where we started. Our report on the 3rd of September was 91 cases. So we are seeing just a bit of an uptick there, but not enough to sound any alarms at this stage in the game. We continue to see a lot of our students who are coming to the Student Health Center with symptoms that may be COVID related, and they're checking those out. Last week we did over 600 symptomatic tests at the Student Health Center, but still had a very low positivity rate, which is very encouraging on a couple of fronts. One, the COVID's low rate of positives, but also it shows that our students are being very vigilant about making sure that if they have any symptoms, that they're getting them checked out. And that allows them to know for sure whether they're have COVID or not, and whether they need to be isolating and talking to their close contacts. So we're pleased that we have those high symptomatic tests going on, and pleased that the numbers are low. And I'd also want to report that we are starting our annual flu vaccination campaign for influenza. We'll have clinics at the Bloomington campus on 3 different days. The first one will be on Saturday, September the 25th, from 12 noon to 6 p.m. Next will be Tuesday, October 12th, from 12 noon to 8 p.m. A full 8 hours there to be able to handle folks that want to come after work. And then on Sunday, the 24th of October, from 12 noon to 6 p.m. So some weekends and a weekday there. All of those 3 clinics will be at Simon Scott Assembly Hall. And we already have the vaccine in inventory and are looking forward to getting it distributed to as many of our students, faculty, and staff as possible. And that's all I have. Well, I did a follow-up for Penny. I may have missed it, but Penny, I think in the initial planning, I'm so glad to see that our testing site will be back up again. And I wanted to clarify, I think it will also offer vaccinations at that site as well. Is that correct?
It will not.
It will not. Okay.
We did think that it would. Original conversations indicated that it would. It may down the line, but it will not when it opens.
Okay, great. Just to clarify that. Great. Thank you very much. That's all I have, Chuck.
All right. Thanks very much, Kirk. We'll go into questions. First one from Dave Askins at the B Square Beacon for Penny Caudill. Today's count of cases was the highest number for this current surge. Are you hearing anything through contact tracing reports about the football game last week as a possible source of infections?
We have not, Dave. There certainly is a concern that, numbers dropped a little bit and then came back up across the state because of Labor Day activities and lack of testing over the holiday weekend, so that some of the tests may have been kind of scattered over time had we not had kind of a lull for the weekend and testing a little bit more difficult. We haven't had anything reported directly with the game, and keep in mind that the consensus is really outdoor activities are certainly much safer, and I know that masks aren't being worn outdoors, but even when it comes to distancing, masks are more important than distancing, for instance, when we're indoors. So I don't have an answer for you. I guess the short answer is I'm not quite sure. I will tell you that we are seeing cases still across all age groups, all areas of the county. So these are not just, they are definitely not just students. And as you just heard, IU's numbers are really very small in the scheme of things.
Okay. I actually don't have another question on tap yet, but I'm going to do the early vamp here for a moment. So I imagine there are some other questions for our group here today. Just I'll plug, as I usually do during the VAMP traditionally, that if you want more information on the Indiana University numbers, you can go to our COVID page, which is covid.iu.edu. And also a reminder that the dashboard for the COVID numbers at IU is now updated on Friday. So now a question from Patrick McGurr at the HT. This one for Shawna. Can you speak to the frustrations felt by your healthcare workers? You mentioned a sense of hope in the spring.
Sure, I'll take a stab at that. I think that the one graph that we showed was the number of patients that have been unvaccinated that are COVID positive and inpatient versus the numbers that have been vaccinated, which is very small in comparison. For our frontline workers, knowing that for the majority, the vast majority, that they could have avoided hospitalization, being in critical care or on a ventilator, is just really heartbreaking as they care for them and really are, tired in this surge, and knowing that other people who need care are putting it off, or surgeries are having to be postponed because of the high numbers of inpatients. So I think that pretty much sums it up. But, any of you that have friends that are nurses or physicians that are on the floor caring for those people, I'm sure if you ask them, they'd be happy to share some of those stories and encourage you to get your vaccine.
Okay. And I'll give it a bit more here as I wait for another question. You guys have done an excellent job in answering all the questions already, it appears. So, but I'll give it a minute more as we hang on here with the legal time that we are allotted for this news conference. Kirk, there is a question that's come in for you. How has the pandemic changed how we handle other vaccines like the flu shot? And to that point, the flu shot is being encouraged at IU this year.
Yeah, so this year we're highly encouraging people to get their flu vaccination. The reason is, of course, it's good for your health and good for the health of campus. But in the big picture, our overall goal in all of this really is to raise or keep a high level of health for the whole community and take demand off of the healthcare system so that it's not stressed any more than it would be. And we all know that influenza can become very complicated for some patients. And so the more people that get the flu shot, the less people we'll have in our hospitals and less stress on the hospital system so they can handle other things that are more pressing. So what we've done this year that's different is than previous years is that we're having these large clinics on several days, and we've ordered a lot of flu vaccine and are going to do all we can to encourage that across all of our social media and other promotional channels. The other vaccines that we require, particularly in the international student perspective, those are continued to be available at the Student Health Center or from your provider as well. Our international students and others who need those vaccinations start getting them as soon as they arrive on campus. In this past year, it was first week of August, we started our vaccine clinics. And we've been doing Moderna Fridays, for example, offering the Moderna vaccine on Fridays in addition to the other vaccines that are available at the Student Health Center.
Personally bothered that we didn't do Pfizer Fridays, because for alliterative purposes, that would be better. But Moderna is a good vaccine as well.
Or maybe we should move Moderna to Mondays, right?
There you go, Moderna Mondays, just another Moderna Monday. The one quick thing about the flu shots as well, I was sent a text this morning as we were doing another IU webinar that tentative dates for the flu clinics at Assembly Hall are September 25th. From 12 to 6 p.m. October 12th, which is the 25th is a Saturday, October 12th, which is a Tuesday, 12 to 8 p.m. and October 24th, which is a Sunday, 12 to 6 p.m. But we'd emphasize, too, that flu shots are generally available in the community as well. Target, for one, has them, and CVS, I know. And Penny, you want to add something on this?
Well, I'll let you finish that thought, but where I was going, someone mentioned to me, I think it was yesterday, I think today, we are like 99 days from Christmas. So, we have holidays coming up very soon. If you have not been vaccinated, there is plenty of time right now for you to get that vaccine so that you can have a better holiday. Whatever holiday you're celebrating, you can have a better, safer one with your family this year.
Okay, so we are at 1:45, but I'm not seeing any other questions, so I think we're going to probably end it there. We will be back again, of course, next Friday, 1:15, with another session, and we'll answer any questions then as well. Thanks, everybody, for your questions, and we'll see you then.
Get vaccinated.